Hello, this is Dr. Edward Dickerson of Fayetteville Plastic Surgery in Cape Fear Aesthetics. We want to welcome you to this latest seminar entitled ThermiRF, where we're going to be bringing you the latest and the greatest of the new FDA-approved skin tightening device using for the neck, for the arms, as well as for the skin around the knees and the trunk area. Also, we're going to be talking about the latest in ThermiRase, which allows us to make those nerves that go to sleep, to make those 11 signs, lasting up to a year. Once again, today we're going to be talking about the ThermiRF. Well, first of all, let me tell you what RF is. RF means radio frequency, and this is the science of heat, if you will. Hey doc, I need something that I don't have a whole lot of downtime because I don't want to take off a week or so at work. I want something that maybe will allow me to last a little bit longer than my Botox or the Xeomin. Hola, ¿qué tal? And so we want to make sure that we are providing for this. Or we have those ones who actually don't need their grandmother's facelift, if you will. They want to look refreshed. They want to, in theory, have it done on a Friday, go back to work Monday. And these are the things that we could actually offer to them. So we've come up with basically those things. Give me another one. We've come up with essentially this tweener kind of therapy. We get great results. We're able to basically keep the price point down, new slide, and be able to provide the things that we need. For those individuals who use Botox, you know that it lasts about 3.5 to 4 months. I got some heads nodding. Whereas a lot of people, although they love to see me, may not want to see me every 3 to 4 months. They want to see the Botox, of course, or the results of the Botox, or the Xeomin, or the Dysport. And essentially, we can do not only ablate the nerve with the chemical, the Botox, we can actually do it with the radio frequency, and that can last 1 to 2 years. Well, that's really kind of fantastic, especially for our busy lifestyles. The ThermiLift and the ThermiTight, we're using that science of heat to basically draw things up. Everybody here has cooked bacon before, right? You put it in the pan, it kind of shrivels up. Well, that's the same thing that we're looking at when essentially we're going between the skin and the muscle. You don't smell like bacon, but you got the picture, okay? Let me go over another slide. Now, there's actually a family that Thermi has actually kind of come out with. Some of them are, all of these are once again minimally invasive. Let me be very clear. There is no cutting. No cutting. Come on in, join the party. We ain't gonna bust you out like the comedy club. All right, so essentially the first one is called ThermiRase. Now ThermiRase has to do with the nerve. That's the nerves that basically give you the 11 sign. And you know when you make that sign that you're ticked off at your spouse, you know how it pulls the brow down. So if we take out the nerves that pull the brow down, either with Botox or Xeomin, we can allow that lifting muscle to work uninhibitedly. Does that make sense? Or are you uninhibited? Did I just make up a word? Anyway, work with me. The ThermiTight basically has to do with the skin. The ThermiLift, we're calling it more for the face, and this is where we do the most of our, and get our great results. And then the ThermiDry, you've heard of some individuals that really sweat more than the average. They are changing their shirts 2 and 3 times a day. They're walking around very embarrassing situations. They always have a coat on, even though it's very hot out. Well, we can essentially knock out the sweating nerves, like with the Xeomin or the Botox, but we can use this radio frequency device to get them potato chip for up to 2 years. Well, that's a big deal, okay? And then the non-invasive ones that are actually coming soon here, the ThermiSmooth and the ThermiVa. And once again, it's just like that. Can be in conjunction with a labioplasty, but it's basically for the tightening of the vaginal vault. And they just use, once again, the same things, and it causes a contraction of the vault. And of course, you can see that both customer and spouse are usually very happy about such things like that. The ThermiSmooth is basically using a heated device where we actually use them more around the eye area that causes collagen stimulation without even going underneath the skin. It works really well for the finer skin around the eyes, if you will. And we're going to have some pictures to show you that. Next one. Next one. So this is essentially, I wanted to give you a model of what this works. So this is going to be your skin right here. And on here, these little columns are what we call septae. Now imagine, if you will, if we basically ate a few more cheeseburgers than we were supposed to, and all of a sudden the thighs got a little bit thicker. Well, what happens is these septae are going to move or stretch but so much, and then they're going to hang on just like the pins on the cushion. This is where you see the dimpling when people call it essentially the adipose or the fat. But that's essentially what's happening. Hence, you lose the weight, you get less strain or pull of the skin from underneath. Is everybody with me on that? And the reason why I wanted to point this out, because this is a very important model. If essentially you do the ThermiTight, if you will, we are running this small little probe, if you will. How big is it? If you would take a pen, a ballpoint pen, and you take out, you know, that little tube that has the ink in it, you're talking about something that small. Actually, it's a little bit smaller than that. So it's something actually very, very small that has a blunt tip on the end. And on that little tip where you would see the little writing part of it, that actually has the radio frequency device on that. And essentially what you're doing is not only dividing the septae, or the thing that would hold the skin down, but essentially you're drawing the you're drawing the skin tighter. So essentially, if you think of you as a bedspread and then a blanket, if we tighten the blanket from below, all of a sudden the bedspread sits a little bit nicer on top. Does that make sense? So the great thing about that is we are dealing with the collagen and the tightening where it needs to be. Minimal invasive without causing damage to the skin.